It may be tucked away in the smallest state in the country, but the work of Brown University's community can be seen and felt across the planet, especially when it comes to public health.
One of the fabulous things about Brown is that we have faculty all over this campus who are working on global health, from South Africa to Ghana to Kenya, Cambodia, Philippines.
This is Mark Lurie. He's a professor at Brown School of Public Health. He spent his career finding ways to help fight the HIV epidemic in his native country of South Africa.
South Africa is a country of 50 million people, and yet we have more people infected with HIV than anywhere else in the world.
Around 7 million people are living with HIV in South Africa. That's more than double the next highest country on the list.
This is something that's really affected every family in really profound ways, whether it's brothers, sisters, siblings. Everybody knows somebody now who's been infected with HIV.
Back in 1990, before the epidemic exploded, less than 1% of the population was living with HIV. By 2000, it had jumped to 14%. Now, nearly a fifth of the country is living with the disease.
Even though we have the biggest epidemic, we also have the biggest treatment programs.
In the past 15 years, South Africa has rolled out massive HIV programs. Its antiretroviral treatment program is the largest in the world. It brought the number of those receiving treatment from just over 600,000 people to nearly 4 million in the span of just 7 years.
Millions of people are still becoming infected, and our need for rolling out treatment, while we've done a great job, really has to be massively accelerated if we're going to have a long-term impact on the epidemic.
But these treatment programs rely on public health experts to help push that needle. That's why Mark Lurie and his colleagues at the School of Public Health partnered with the University of Cape Town to form the SASH Program. SASH trains and educates the next generation of health leaders to continue advancing HIV treatment.
When we were setting up the SASH program, I think one of the things that we wanted to do was to really make sure that they get their hands dirty in research, that they're involved from the beginning process where you're starting to think about what the research questions are, what do we already know, and what important information is missing.
Faculty and fellows spend time in both South Africa and Providence during the course of the program. It's a partnership that doesn't just cross borders, but disciplines too.
And that's really the kind of approach that we need, because a small, narrow approach that's very bound by discipline is unlikely to be able to understand and address the complexity of a health problem.